You can see here the audiogram. Do you hear me clearly?
Bonjour, c'est Béziers.
Oui.
C'est Rinze and Jacques, and we like to hear your comment on your case which you are going to present.
Okay. This is a 35-year-old woman. She has a congenital hypogammaglobulinemia, and because of that, she has permanent respiratory infections. And she developed a bilateral chronic otitis, which creates a bilateral mixed hearing loss. Because of this immunotary disease, it is not possible to improve her middle ears by surgery, and so we decided to implant a BAHA on the right side. And you can see that she has a very severe mixed hearing loss on the right side, 90 dB hearing loss, with 50 dB airborne gap. So, on va montrer l'oreille maintenant. Implant a BAHA, the new implant with the abutment which is covered by hydroxyapatite for better tolerance. And I will show you the technique that we use in the clinic. That means implantation without skin reduction and without incision, just through a punch cut. So, okay, for the position of the BAHA, of the implant, is 45 degrees superior and posterior to the external auditory canal. And the top of the processor is approximately at the top of the pinna. So, first, I mark with a pen the position of the implant, and then, faut baisser un tout petit peu, I will measure the thickness of the soft tissue in order to determine the length of the abutment. So, with a needle, up, I make a puncture at the site of the implant, and I will measure the thickness of the soft tissue. In that case, they are very thin, approximately 4 millimeters. So I will use an 8 millimeter abutment. So, next step, I will make infiltration.
Excuse me, Thibaud. Is that a device which comes with the abutment that you can measure it with that, and you see the number of the height you're going to use? Is that going with the package of the implant?
Yeah, I do that every time because when I implant without reduction of the thickness of the soft tissue, I have to fit length of the abutment to the thickness of the soft tissue. So I measure like that, and the little plate to measure is provided by Cochlear.
Okay, thank you so much for this information. Did you put some local material in? In anesthesia, Yes.
What do you mean?
I mean, if you have local infiltration over there or not?
Not for the moment, because I don't want to infiltrate at the site of the implant. I will infiltrate around it, but I don't want to infiltrate at the site of the implant in order to avoid to thicken the soft tissue.
Exactly, so that was my question. Yeah.
And you can see that I push on the capsule, on the healing cap, in order to press the soft tissue at the site of the implant. And now I can make the skin excision, le punch, with a 5 millimeter punch. Up. And I go direct to the bone. passe râteau. Voilà. And I will make now hémostasis. Alors, pince à griffe. Non, vous faites sur l'aspiration. Feu. Pince à griffe. Feu. Feu. Vous me dites si je masque. Hein? So I make the hemostasis of the subcutaneous fur, subcutaneous tissues. Feu. Okay, it begins to be okay. And now I will make the incision of the periosteum itself with a knife, no, bistouri. I make the incision of the periosteum itself and a 2 mm incision in order to widen the exposure. And now you cannot see it, but I cannot see very well the bone, and I can remove the periosteum at the site of the implant. Okay? Now I will make the pre-hole with a little drill, 3 mm deep. Hop, de l'eau. Okay, and now check if there is still bone in the depth. Okay, now I can drill to 4 mm. Je vais prendre le bistouri électrique un instant.
Thibaud, do you pre-operatively do scanning of the skull to see the depth of the skull? Or
no, in practice, no. No, in practice, no. I checked yesterday the size of the implant that I implanted in my experience. I implanted 230 BAHA, and on these 230 there was 16 3 mm implants. That means it's a very little number, in fact.
Yeah, especially in children, I think, huh?
So I go now to 4 mm depth. To 4 mm depth. Ok. Donc on va prendre un implant 4 avec pilier 8. I check one more time if there is some bone in the depth. Yes, that's okay. And I have to enlarge the size of the hole with dual countersink. Okay. And I check. I make it 2 times. Okay.
Hello, Utrecht, this is Marco. Can you hear us?
And I check the last time if there is still bone inside.
This is Hernoper. Can you
now
hear
I
us?
can expose the rim of the bone around the hole. I'm sorry, because probably you cannot see the rim of the bone. Up, you can see the rim of the bone around the hole. And I will be able now to implant the implant with a pre-mounted abutment.
Evet, şu anda her şey birbirine bağlı. Hem o makine hem şu anda
Okay, adapt, I fit the speed of the motor. Okay.
Onlar zaten şu anda hepsi gidiyor. Ben sadece kamerayı çevireceğim.
Okay. Wait. And now I will directly fit the implant.
I'm sorry. Please, can you hear us? Can anybody hear us?
Şu anda bağlıyız zaten. Bağlı mı Hollanda ya? Bir saniye.
Okay. And you can see the result. There is
Hello?
no date.
Is this Hanover? Is there a question from Hanover?
İndir onu aşağı. Durdur ve indir aşağı. İndir aşağı.
Hello? Gehen wir nochmal auf den Stapetes-Reflex, bitte die dritte Elektrode.
Hanover, do you have...
Hello?
Yes,
Can you hear
hello,
us?
this is Rinji.
Yeah. Hello, just
Yeah.
one, if you are interested, we just can demonstrate you the Stapetes reflex measurement interoperatively. So we are looking on the stapes tendon. It's very briefly only. And then we see the tendon movement. Nochmal, ein bisschen mehr noch. Ich kann es noch ein bisschen größer machen. Das ist am Ende am Anschlag schon. So you see here, that is the stapes tendon.
I just have to put the healing cap.
And then we just,
And some
you see the movement with the
around
electrical
the
stimulation. Very small movement, but it's visible, I hope so. Just a good control for the function of the implant and the response of the nerve by the electrically
Maar dan moeten we het ook in beeld hebben, want dat heeft geen nut.
reflex.
Oh, ja, dat kan schakelen.
Okay, that's all what we wanted to show.
Oké, nou dat is al klaar.
Okay?
Okay.
Thank you.
Thank you so much, Thomas.
Okay, see you later. Bye.
See you later. We go over to Thibaud. The very nice demonstration, Thibaud.
And see,
Can you
I
hear me?
like this technique because it's clean, there is no bleeding, and it's very simple. I just have to put now
Yes.
the healing cap, and that's finished.
Yeah, and it's fast as well, huh?
Yes.
Do you also
And the
in local?
advantage, it can be done under local. Usually I do it under general because in French patients prefer general anesthesia, but
Oui.
you can do it under local. And the result is in fact you avoid the scarred tissue, the scarred area around the implant, and that makes the technique more acceptable for the patient. The only benefit, the principal benefit in my opinion, is that this technique makes the BAHA more acceptable for the patient. The other
My
benefits
experience,
are-
my experience is on the people from the Mediterranean. They're not really fond of having a BAHA. What is your opinion about that?
Yes, I agree, but it will be more easy for them to accept the BAHA if at the end, after the surgery, there is no scar area without hair around the implant.
Yeah.
The implant is directly in contact with hair or no scarred skin, and so it makes the technique more acceptable.
Oh yeah, that's good to show us, and you did it in a very nice way. Thank you so much.
Bye-bye. See you
To
later.
another university. Yes?
Okay, and
And see you later on.
see you later.
Okay.